Okay, let's start. Today we're going to go over the skeletal system, right? And I presume you have prepared for this quiz today on the skeletal system and the joints. You have read all the 4 chapters, right? Chapters what? 5, 6, 7, 8. And you did all your discussion board last night, including your what? Mastering A and P assignments, right? Just to remind you, do not forget, the deadline is always what? The Sunday, what time? 11:59 p.m. before that face-to-face. I made it very clear, right? Do not forget. You did not make it clear the first day of class. I did. So, 2 things you need to do. Discussion board, your responses. When you do your responses, make sure you have your initial response. Well, I don't know if I mentioned it should be at least 8 to 10 sentences or more. The more comprehensive, the better. I see some of you only 3 or 4 sentences. It should be at least 6 or 8. At least I can say that you're doing something. Because some of you are going to see 1 or 2 or 3 sentences. That's a lazy student, Some of you have 4 paragraphs. Amazing. I'm not kidding. Some of you have 4 paragraphs, And what do you put at the end? Yeah. Some of you do not have. Did I not mention that also in the first day of class? I did, right? So don't you take down notes when I say these things? That you have to put your references because that's part of the rubric when we grade them, right? So be sure you have it there, right? Second, and then when you respond, how many responses at minimum? 2. Very good. And just don't say hi, hello, you have a very good discussion. That's it. No. You have to explain why did you agree or, and I have seen some people with 1 paragraph, 2 paragraphs, just a reaction, which is good. Because the objective here is to interact with your what? Your peers, your classmates, making them feedbacks on how they did in their presentation, right? But ultimately, now some of you of course use other reference, but the most important reference would be what? Now just because we say, oh Dr. Lam, we're even using the same textbook, so why do you have to put the reference? You still have to put the reference. Because you can see in the rubric on, I think, on mechanics, that's part of the mechanics, right? Do you understand? Now, regarding mastering A and P assignment, of course, I made it very clear to you, you have to do it when? Sunday or Saturday? Why Saturday?
In case the website crashes.
What if the website will what?
Crashes.
Can we control that? We can't because Pearson is Pearson. I'm not Pearson, they're Pearson, right? If they crash on a Sunday, then you have 0. Great. Although it says only what, 1.5, 1.25 points, but there's a 2 parts for every chapter, right? So please do it on what? The soonest possible time. If you're going to be told do it tonight, tomorrow, or before what? Before Saturday, so much the better, right? You don't want to lose those points, okay? The problem is that we have already scheduled them on deadlines, okay? The deadlines are set, preset. That has to be the Sunday before what? The face-to-face. But again, ultimately, it would always be better to do it when? Before Saturday, or Saturday would be the latest.
Did anybody not sign in their roster?
Sunday morning is sometimes hard. Or there are times I make a mistake. Instead of put 11:59 p.m., I put 11:59 a.m. So it's better that you do it before Sunday. What day? Saturday. Okay, Saturday. Is that clear? So it's not hard because it's always 2 things on that week. The discussion board and of course the mastering A and P prior to the face-to-face presentation. So last night I presume you did chapters what? 5, 6, 7, and 8. And you also did the discussion board. Okay? Okay, now today we're going to talk and review about what you have read. In chapter 5 we talked about the skeletal system, right? Why is the skeletal system important? Anyone? Yes? Yes. I gave you a study guide, right?
Yeah. It provides protection.
Protection to what?
For the organs.
Can you give me an example?
The lungs, like the thoracic.
Are we good? Okay.
Like the thoracic cage will protect the lungs.
The thoracic rib cage will protect what? The heart, the lungs. Yes, very good. Is that important? Is that necessary?
Yes.
Will that provide you with 100% protection?
I don't know about 100%.
If you get shot here or stabbed, will it?
I mean, it's definitely
Maybe not, right? But at least it's some degree of protection, right? Okay. What else? What about the skull? What does the skull protect? Brain, because the brain is soft and the skull is what? Hard, right? So the skull is hard and the brain is soft. Does it need protection? It does, okay? Heart and lungs protected by, for the thoracic rib cage. What about the pelvic organs, such as your uterus and your what? Fallopian tubes, and the ovaries down here. Are they protected by these pelvic bones? Yes, they are, right? So apparently, it's important to note that what else is another function of the skeletal system? Anyone from this side of the group? Yes?
Leverage.
Leverage for movement, when you move the joint in physics, right? Elbow flexion, extension. Okay, what else?
Support.
Okay, support, right? Protection, what else?
Mineral reabsorption.
Okay, which where you store what mineral stored there? What else? Phosphorus, phosphate, yes. What else? What's another important function of your bones? So does that mean that? Yes?
Cell production.
Huh?
Blood cells.
Okay, blood cell production. Okay? And where are these blood cells formed? Exactly where in the bone?
Medullary.
Yes?
Bone marrow.
Which bone marrow?
Spine.
Huh?
Spinal bone
Okay. Which bone marrow? Red, of course. What is the color of red blood cell?
marrow.
Red. What is the color of red bone marrow?
Red.
Red. What's the other bone marrow that we know?
Yellow.
And what's the color of yellow bone marrow?
Yellow.
Oh my God, I love anatomy. Don't you love anatomy? It's so simple, right? What's the color of yellow bone marrow? Yellow. What's the color of red bone marrow? Red. Okay? So apparently the yellow bone marrow is yellow, the red bone marrow. We'll go into the details there later on, right? Okay. So those are the functions of your bone. In other words, bone is important because it is here where you produce your bone cells. The red blood cells, your white blood cells. Red blood cells are important for the transport of oxygen and carbon dioxide. On the other hand, your white blood cell is what we call the soldiers of the body. They protect you against what? Infection, right? The white blood cell. They attack the enemy. They're the Marines. Okay? Now, what about your platelet? What does the platelet do?
Sticky.
Sticky. What do you mean sticky? Yes? Yes? Blood clotting. Wow, I can tell that you're studying, huh? And what exactly is a blood clot? Say, you know what I'm saying? You might know the answer, but you have to know more than that. You have to tell me what it's for, where is it formed, and why is it necessary for us? Why do we need to have our blood to clot?
You don't bleed out.
Bleed out, why? What does the platelet do?
Scabs.
Anybody? I know it's not. We're not talking about the blood circulation here, but some people might have gone beyond what is in the skeletal system, right? So it protects you by what? Does anybody know? Okay, let's say you have a wound and there's bleeding. If there's bleeding, what structure is affected? Make it simple. KISS. Keep it simple, student. If you have a wound, there's bleeding, what structure is affected? Huh?
Vessel.
A blood vessel. Okay, you keep on saying vessel.
Yeah, I know.
You always say blood vessel, my goodness. So which you have two types, arteries and veins, and the third is the capillary, right? So let's pretend this is the blood vessel called artery, right? Or a vein. If you have a wound, what's inside the blood vessel?
Blood.
Of course, amazing. And anatomy is so simple, right? What's inside the blood vessel? Blood. And you have two types of blood, venous blood, rich in carbon dioxide, and blood that is arterial blood, which is rich in oxygen, right? So if there's bleeding, let's say a stab wound, gunshot wound, there is what? A break in the wall. And there is a break in the wall, what will extravasate or come out?
Blood.
For the blood, that's why there's bleeding. If that happens, what can happen? You can die. You can bleed to death, right? Especially, which is more dangerous, arterial or venous? Arterial bleeding, right? Because the blood pressure is much higher. So when the blood comes out there, what will the platelet do?
Bind together.
No clot.
Okay, they agglutinate, they clump together, okay? And then they form a plug. You know what's a plug? So they will go there, and they form like a temporary what? Temporary what? Plug, P-L-U-G, to stop the bleeding. And then later on, and you will learn this when we talk about the hematogenous system and the hematologic system, there are what we call clotting factors, right? Produced by the liver, and they will cause the blood to ultimately clot. Your fibrin, you know, and then you have a clot which will stop the bleeding. You understand how important that is then, okay? Platelet produced by the bone marrow. Which one? The red bone marrow, okay? And what is the yellow bone marrow made of, therefore? Fat. What's the color of fat? If I were to die today and you were to dissect me, what would be the color of my fat? Believe me, we do a lot of cadaver dissection at UCLA. Every time you dissect someone with a fat belly like me, so much yellow fat. And that's the one that will kill us. Why? It goes to your arteries in the brain, heart, right? Okay, now, when you're dealing with bones or osseous tissues, you probably saw this in the first week of class, right? In my class, I showed my lab students what a bone is like, right? And this bone tissue is made up of cells, correct? Okay? And these tissues or cells are of different kinds, right? So, if I were to write something like that, again, going back to what we call a concept map, it's a bone cells. Can you give me the names of these bone cells? Huh? Yes? Osteo what? Which one? The one with the B or the C?
The B.
The B, okay. Osteoblast.
Osteoclast with a C.
Huh?
Osteoclast.
Osteoclasts with a C.
Osteocyte.
Osteocyte with a C. And then what's the first one here? Osteoprogenitor cells. How many of you have been to my Joel Gamo MD website and subscribed to my website? You did subscribe. It's free? Were you charged by Dr. Gamo? You were not, right? Because it's, as of today it's free, but next year I will charge everybody who goes into my website. I'm just joking. Okay. Did anybody watch that lecture I had for the faculty here about concept maps? No one, okay, because you're too busy studying for today's quiz. Never. If you have a chance during your free time, if you subscribe to my website, Joel Gamo MD on YouTube, you have access to all the videos I have, including that one on concept map. This is an example of a concept map. A concept is an idea, which is the basis for our knowledge, right? It's a map. What's the purpose of a map? To give you directions so that you will reach your what? Destination. What is your destination here? To learn. Learning something that you can apply later on when you become nurses, right? You try to acquire knowledge that is necessary. But in order to do so, you have to be very organized. Some people read the book 10 times, and what do they get? A 60% score. Some people read the book once or twice, but got a 90%. Who do you think did a better job? Of course, the one with the higher score, right? You could read a book 10 times, but if you did not understand what you have read, and you did not retain the information, what will you recall during an exam? Nothing. You don't recall what you have retained. But the only way to retain something is by doing something that will organize the knowledge that you have. Okay, let's pretend we're going to create a concept map. I put the word bone cells there. We have listed all the 4 cells that we are expected to know. What word, and you only write down the key words. What are key words? Important words, relevant words. If I use the word stem cell, which among these 4 would be a stem cell? Very good. You're very smart. Stem cell. I put an arrow there. Which among these 4 would actually be the immature bone cell? Which one? The B or the C? B. It's the site, right? The B. It says immature what? Cell, right? Now, do I have to write bone? I don't have to, because it's already bone there, right? So bone cell, immature cell. Which one is the mature bone cell? What? Osteocyte or osteoclast? Okay, I already wrote the answer, so that's the answer. Okay. So mature, immature, and what would be the appropriate word that you can put under the word osteoclast? It's for what?
Breakdown.
Bone breakdown. Okay, can you give me one word that means bone breakdown? Who said osteolysis? You're the man. What's your name?
Ryan.
Huh?
Ryan.
Toledo?
Yes.
We're the one who helped me carry the skeleton here. You get extra points in heaven, okay? because I came from the elevator and I was holding all my bags and pushing the bone. You need help, Dr. Gamo? Okay, go ahead. I'll make wee-wee and you bring it to the classroom. I was able to release my bladder, you know, because my urine was crying to me, please release me, let me go. Goodbye, urine. So according to Mr. Toledo, it's called what? In fact, osteolysis means, what does lysis mean?
Breakdown.
Breakdown. What does osteo mean? So do I need to write down the word bone breakdown there again? But do I expect you to know what osteolysis means?
Yes.
So smart learning is using your head. Not the skull, but the brain. My goodness. The point is, what did I write here? Keywords. Words that you are expected to understand and be able to retain. So if I were to ask a quiz today and say, which among the bone cells is responsible for bone breakdown? The answer would be what? Classed. There's already 1 point. Out of 30 points, you get 1 point. Isn't it amazing? And should everybody should get a perfect score then, huh? Of course. There's no reason not to get a perfect score because you are very smart. And a smart student has to do what we call smart learning and smart studying, right? Okay, now, with regards to the osteoblast and osteocyte, one is mature, one is immature. Okay? So which one will produce the bone matrix? The blast. Okay? Bone matrix produced. Which one? So that's the bone. Which one will monitor the amount of bone matrix? Site. So is there a difference between monitoring and producing?
Yes.
Definitely there is. Can you give me another word that means produce? Huh? Huh? Sensitize? Well, yeah. What else? Manufacture. Produce. Manufacture, produce, right? Okay. Now, bone matrix. And what is this bone matrix made of? Anyone? Yes? Yes? What is that bone matrix made of? This is in the first chapter, chapter 5, right? What is that bone matrix made of? Huh?
Calcium phosphate.
Calcium phosphate. And what else? So calcium phosphate, your collagen fibers, and basically what? Your hydroxyapatite crystals, right? Have you heard about that? Calcium phosphate, that means you need calcium and phosphorus. You have your hydroxyapatite crystals. Will that help the bone stronger? Yes, calcium. That's why when a patient suffers from osteoporosis, do we give this patient with osteoporosis calcium supplements? Yes, we do. Can you get calcium from milk? Most likely, yes. You understand what I'm trying to say here, right? Okay, now, the osteoblast, once upon a time, used to be what? Anyone? What is the original cell that became the osteoblast? Huh? The what? Anybody? Yes?
Cuboidal cell? No. The osteon?
Okay, again, let me rephrase my question, class. The osteoblast used to be,
Right?
why am I smiling, do you think? Is your answer right or wrong?
I think it's right.
Why? Because I was what? I was you're the woman, okay? If I were not smiling, I would not be smiling because your answer was wrong. Okay. But because I was smiling, the answer was, how did you know it was osteoprogenitor? Where did you get that information, my dear? What?
The book.
The what?
The book.
The what?
The book.
Okay, I'm just trying to what? Repetition is the mother of all retention. Where did you get that info? Out of 30 plus students, one person gave me the right answer, and you are all using the same what? And one person gave me the right answer, the rest, it's okay. That's how you learn. Why did you get it, and how come I did not get it? There must be something wrong. Right? Have you ever wondered? Did you know about osteoporosis becoming osteoblast? You know? You know. Why? Okay, can you point to me, my dear, what's your name? I'll give you 1 minute, 2 minutes to look in that book where it says osteoprogenitor becomes the osteoblast, okay? Tell me what page, what paragraph, what line, the osteoprogenitor becoming the osteoblast. Go ahead, as we continue with the discussion, right? But apparently, some people read the same book, read the same paragraph, but, yes, you saw it?
Page 108.
Okay, everybody go to page 108. Yoo-hoo.
Okay, so it's the last for osteoprogenitor.
Wait, give me the paragraph, what column, first column, second one.
For just the osteoprogenitor itself.
Becoming osteoblast.
Becoming osteoblast. The second class.
Now, what does it say there? Verbatim, quote.
Oh, wait.
This is becoming the better cells and different
The last paragraph.
Okay, check, tell me.
Okay, so bone tissue also contains small numbers of stem cells formed osteoprogenitor cells. Osteoprogenitor cells differentiate from mesenchyme and are found in numerous locations, including the innermost layer of the perosteum and the endosteum lining of the medullary cavities.
And then?
Osteoprogenitor cells divide to produce daughter cells that differentiate into osteoblasts.
What? Stop there. Stop. Do you know what I'm looking for? That's what I'm looking for, right? Okay. So, did everybody read that part? Maybe not, maybe yes, right? Because if you did, and if you retained the information, you should have given me the right answer. But in life, are we able to learn everything? No. But in life, there are things we need to know, but we don't know because we probably fail to realize how important it is, right? Do you think it's important that the osteoprogenitor is a stem cell? It eventually becomes what? Osteoblast. Now what gives rise to your osteocyte? Huh? How? Why? Huh?
When they mature.
When they, of course, don't you love anatomy? The word is mature. Like me, I was immature when I was 1 year old. Now I'm mature. Okay? I'm 57 years old. After 56 years of existence, that's the only time I became mature. Last year I was immature. I'm just kidding, of course. The point is, the osteoblast, when they mature, because they are immature cells, they became what? In other words, osteoprogenitor cell. Can I put an arrow here? Can I put another arrow here? You see the relationship? That one leads to the other. The osteoprogenitor cell becomes the osteoblast, and the osteoblast becomes the osteocyte. Will the osteocyte become the osteoclast? Yes or no?
No.
Yes or no?
No.
Of course, no. It's a different type of cell. So for bone formation, the blast. For bone breakdown, the clast. Okay? Does that make sense to you, students? Now, why is that so important to understand? I'll give you an example. Have you heard of the disease condition called osteoporosis? Have you heard of that?
Yes.
Okay, what does osteo mean? What does pore mean? Holes. So where are the holes found? In the bone. So there are a lot of holes in the bone, right? When there are a lot of holes in the bone, will that make the bone stronger or weaker? Can it easily break?
Yes.
Can you develop what we would term as pathologic fracture? It's common among a young person who's 20 years old or an old woman who's 80 years old. The 80-year-old woman, why? Can anybody explain to me why is this so? Yes?
Low estrogen level.
Okay, the answer is correct. You said in women who are 80 or 60 years old, they develop low estrogen level. So again, to become smart, you always ask questions like why, how, where, when. Okay? What is your name, dear? Are you in my lab class? Are you Gayani? The answer is correct. A woman who's 80 years old has low estrogen levels. Why?
Because they lose the calcium more.
Hmm?
Because of the low estrogen, they also lose more calcium.
Okay, my question is, why are these women have low estrogen levels?
Because of climax.
Huh?
Climacteric period.
The what?
Climax.
Climax or climacteric?
Climacteric.
Are you talking about menopause?
Yes.
You know what menopause?
Yes.
What is menopause, Gayani?
Menopause. It's
Okay, Gayani,
yes.
what is meno?
Blood.
Meno. Menstrual.
Menstrual.
What is that?
Is the menstrual rate?
No. What does it mean to you, a woman like you? Not me. When you say menstrual period, what does that mean? Every month you have what?
Yeah, period.
The bleeding comes from what? The uterus or the vagina?
Uterus.
It comes from the uterus but passes to where? The vagina, which I do not have, right? So I don't even have this, right? Okay? So the bleeding comes from the uterus, it passes to the vagina. Look, Ma, there's blood. You're what? You're 9 years old, 10 years old? The first time you had your menstrual flow. I don't remember that time because I never had one, right? Some women have 9 years old, 10, 11, right? It's called menarche, right? So what is common again? Men. Arche. Okay, first time. And what does pause mean, my dear? Stop. So what does menopause mean? You stop what? Vaginal bleeding. You're too young, I don't even think anybody would be in that stage, right? And when a woman reaches the age of menopause, between the ages of 50 and 60, what happens? Where do you get that estrogen that you were saying? What organ produces estrogen?
Ovaries.
You're the woman. I like your ring. What's that? Diamond or not? Ovaries. Estrogen, correct?
Yes.
Estrogen is produced by the ovaries, but what happened to a woman who's 50 or 60 years of age and above? It atrophies, becomes very small, which we really see in a cadaver. Usually when we dissect a human female body, the ovaries are small as this, very, very, very small. Atrophy is what it means. Atrophy means decrease in size. Obviously, the amount of estrogen will also be absent or lower in value or concentration. Okay? Now, the question is this: what is the correlation between estrogen and osteoporosis? Now, let me see if you have read that, and if you did in the book, give me the paragraph, give me the page, and the line if you did. Now, does anybody know? Yes, I see a hand, and what is your name, my dear? Victoria. Is it Christian?
Yes.
Okay, I don't even know how to spell your name, but I know it's Victoria. Yes, Victoria, tell us.
Estrogen helps produce the surface of the osteoblast. So as you age, the osteoblast produces, but the osteoclast site remains the same production level.
At least you tried. Unfortunately, that is not what I'm looking for, and I'm not smiling. But at least don't be afraid to answer. Whether the answer is right or wrong, I open myself to any answer. But just at least to try. Unfortunately, that's not what I'm looking. Yes, my dear.
It says sex hormones at puberty bone growth accelerates dramatically. The sex hormones estrogen and testosterone stimulate osteoblasts to produce bone faster than the rate of epiphyseal cartilage expansion. Over time, the cartilages narrow and eventually ossify. The continued productions of sex hormones is essential for maintaining bone mass. So once they have a decrease in estrogen, obviously their bone mass is going to decrease.
Okay, that's partly the answer, but it's not. I will partially accept that, but partially. And that's actually the answer to your what? What? Oh my God! Of course, puberty. Remember, sex hormones, puberty. So when I was what 9 or 10 years old, I was this tall. But when I reached the age of 12, I became in the Philippines, I'm already considered a giant, you know. I used to play center. I was a Shaquille O'Neal in my classroom, in my basketball team, because I was taller than anybody else. And it's responsible for the hormones and puberty. Guess what? I developed what? Axillary hair, bigger voice, muscles a little bit bigger, pubic hair. I had testosterone. Okay. Now, in women, it's estrogen. Now, can anybody else give me another idea or reasoning? Why is it that in other words, I'll be direct to the point. What is the role of estrogen in relation to your osteoclast? What does estrogen do? Okay, I'll be even direct to the point. Does estrogen inhibit osteoclast or stimulate osteoclast? Huh? I want you to think, Gayani, because I'm not smiling at your answer. Okay, what did you say the word inhibit? Did you see that? Or just also just because I give you the answer?
No, I'm just assuming because with osteoporosis
Okay.
there is less than bone mass.
Okay, so estrogen apparently will what? It's supposed to inhibit what? This. Why? Because it's supposed to stimulate this, right? But inhibit this because what does it do? Break down the bone. What is the word? What is the word? What is the word? Inhibit what? C. Last. Okay? Inhibit what? Now what happens in menopause? In menopause, can you still see me there? Okay. Still handsome? Thank you. Menopause? Decrease what? Estrogen. What happens now? If you decrease your estrogen levels, will you be able to inhibit this?
No.
Not inhibit osteoclast. And there will be a lot of what? Lysis. Lysis will be present. And what is lysis again?
Breakdown.
And that's the reason why the bones end up with so many what? Pores. Right? Pores. Does that make sense to you guys? So the idea is that the prior knowledge that you have here is important to understanding abnormal conditions. When I teach pathophysiology a year from now in your class, if you come to my class or Dr. Bakhtiari or Dr. Sue Park, this is exactly what we tell our students. The foundation of nursing is always what? Anatomy and physiology. If you do not know this, then you will not know this, and you will not know this, and that is the reason why you fail the nursing board exam. Do you understand? The bottom line, therefore, is that knowledge such as this has to be understood, has to be retained. How long? For how long do you retain this information? Huh? Of course, forever until you die. Unless you continue to study in heaven, well, is a spiritual study room there, up there. So when I am 140 years old and I say, what's your name? Alessandra. What is the bone cell for bone breakdown? What's the answer? Are you sure? What's another name for bone breakdown? Were you my student 100 years ago? So the knowledge you have now will remain the same. I'm just being intense when it comes to learning. Knowledge is free. No, in this school it's not free actually. I'm in trouble now. But it's worth it probably because in the blended learning, you active learning, I'm here to facilitate the learning process, but you come to class, you are prepared now, right? Before I used to have a hard time. How many of you read the chapters 1, okay, 5, 6, 7, 8, 0, because they expect me to explain everything, right? And I spend 5 hours. Now in the blended, I'm so happy. Because you are forced to read. Because you have to do the discussion board and the mastering A and P. And it's for your own good. Honestly speaking, there are a lot of problems, but initially, I think in the long run, it will really benefit you. Because you will read ahead of time. When students come to the classroom and they don't, what the heck is osteoclast, osteoblast, osteocyte, they go like this, looking at me during the lecture. I've been teaching here for 10 years, so I know. I look at your face, I already know whether you know the answer. I hope you don't mind. I just look at your face, I already know whether you know or not. That's not your fault, it's my fault. I'm so good in looking at facial expression. I just look at you, I already know whether you know the answer or not. It's not because I want to humiliate you, I just want you to know, I want to verify my facial profiling, you know. It's not racial profiling, but facial profiling, you know. You know what's facial profiling? I look at your face, I look at your movements of your facial muscles. So don't you ever look at me like this. That means there's nothing inside the structure between your ear, which happens with the brain, right? Do you understand? I have a dream that all my students become very smart, and all my students will get an A. Because if you get an A, then you'll get an A in physiology, and you get an A in pathophysiology, and you all pass the nursing board exam. A person who gets an A, who will get an A in my class in pathophysiology, 99% will pass one. NCLEX board exam. Studies have shown. Because they did the correlation. All teachers teaching pathophysiology, they look at the grades. All the students who got an A in pathophysiology, guess what? They all passed. You understand what I'm saying? And how do you get an A in pathophysiology, you get an A in physiology? And what should you get here? Are you going to be happy with a 73? What happens if you get a 73? What will grade you'll be with physiology? 73 or 72.5. What grade do you think you'll get in pathophysiology? 72.52. Barely passing. And what happens during the nursing book exam? You might fail. And what happened to your $150,000 investment? You have a chance to take it again. Down the drain. Down the drain. Do you understand? Okay, going back to this. So, do you understand what I'm trying to say? Now, what do you think should we do for these patients? The osteoporosis? Huh? Okay, there is a answer here, give hormones up. We used to do that. Unfortunately, when I was in medical school, we used to do that in 1985, okay? It's like it's a common sense idea. You lack estrogen, what do you give the women? Estrogen, hormonal support, right? Replacement. HRT. Guess what happened to them, yes? What cancers did they develop?
Oh, breast cancer.
Why do people want the hormonal replacement? Because they want to get rid of the hot flushes. You know what's hot flush? Can I borrow that paper? Paper. A 60-year-old woman who goes like this. Why is she doing that? Hot flushes, right? Is it good feeling? I'm sorry for doing that, right? But they become very irritable. You want to have sex with them. They don't want to. I'm hot. I'm hotter. They didn't get the joke. It's okay. I feel so hot, honey. Okay, turn on the aircon. Duh. Simple problem, simple solution, right? But we used to give, for hot flushes, we used to give that, right? And for osteoporosis treatment. But unfortunately, they developed what? Did we stop or did we stop? We stopped. Which one can kill you, the hot flushes or cancer of the breast? There you go, okay? Now, anyway, how can you prevent the development of osteoporosis in your grandmother who was 70 years old? What is the best thing that you as a nurse can educate them with? Huh? What? Aside from calcium and milk intake, what else?
Weight-bearing exercise.
Walking or walking? Walking or walking? Marathon running or walking? Okay, if they join the marathon, they'll die in the marathon. So let them run. So when you walk, is that a weight-bearing form of exercise? Weight? Good for the mother and grandmother?
Yes.
Can that help prevent the development of osteoporosis?
Yes.
Now, in women with osteoporosis, one of the areas affected most of the time is this area here called what? If this is the head, this is called what? If I have a head, what do I call this? Now, there are two types of bones, right? Compact and compact. Which one do you think is stronger? Which one is weaker? Sponge. You know what's a sponge? SpongeBob? Weak, soft. SpongeBob. Okay. So it makes sense. Don't you love anatomy now? Your grandma helped sustain a hip fracture in the neck because spongy bone is weaker bone. So grandmother is walking in the garden. Oh, Frederick, where are you? Looking for the dog. And then fell, breaks the hip. So it's all Frederick's fault. Am I still there? Okay. And if you fracture the femoral neck, what happens to the blood supply to the head? No more blood supply. It's called necrosis of the femoral head due to the disruption of the blood supply, particularly the arteries of the bone. Do these bones require arteries and veins? Yes, because these are made of cells. Cells that make up the tissues called bone or osseous tissues have to have blood supply because they need oxygen, glucose, nutrients, right? Just like your heart, your organs, your muscle, they need blood supply too. Liver, hepatic artery, hepatic vein. You have what? Arteries and veins and capillaries for the bone, right? So, when you break the neck of the femur of your grandmother, there is no blood supply, this dies. So what do you think Dr. Ogamo will perform in this patient? Yes? What will I do?
Surgery.
Huh?
Surgery.
Surgery. What kind of surgery do you think I'll do? Huh? What?
A hip replacement.
Very simple, hip replacement.
What?
So I go to Walmart. Can I buy a right hip? Size medium? You know what's a hip replacement, my dear?
Yeah.
Tell me. How do you know? How come? Are you an LVN?
I'm a surgical tech.
You're a surgical tech, okay. So what is a hip replacement?
So
Do you know this technical scientific term because you're a surgical tech? What is the technical term for hip replacement?
No.
I'll give you a clue.
Okay.
I don't do this during a quiz, but in a verbal discussion.
Arthroplasty,
There you go. Because arthro means joint, and what is plasty?
reconstruction,
Repair or reconstruction. Rhinoplasty, mammoplasty, either augmentation or reduction. Arthroplasty of the hip is another term for what hip replacement. Arthro means joint, plasty means repair. You're absolutely right. So what do you do in hip replacement? You're a surgical. Have you ever assisted in doing a hip replacement, my dear?
I have.
I'm just curious. Do surgical techs are you in the operating room
Oh, yes.
or just the surgical nurses?
No. My hands are in the like I'm help assisting.
Oh, really? I like that.
So there's two ways to do a hip replacement. You can do an anterior approach, or you could do the patient can be lateral, and you could do a total hip replacement.
What is a total hip versus partial?
So
You might be
hemi
interested. It's a
hips,
surgical. Yes?
I believe hemi hips are
Okay.
just the head and the neck.
Okay.
Because with the total, you would do the acetabulum.
Perfect. So you see this acetabulum here? If you remember, what kind of joint are we dealing with the hip? Is it the ball and socket joint? Which one is the ball? Which one is the socket? And what is the name of the socket here? Acetabulum. It's called the femoral head. This is the ball and socket joint. It's a universal joint that allows flexion, extension, abduction, adduction, external rotation, internal rotation, and what? Circumduction. So in a total hip replacement or total hip arthroplasty, we replace both the head, with titanium. You know what titanium? It's a metal that is biocompatible. What do you mean by this? It's not rejected by the body. Not rejected. Compatible with the body. Titanium head, and then what? Replace that with an artificial, what do you call this, socket. Okay, you understand what I mean? Okay, that's total. What about partial? Partial, we retain the old acetabulum, and then we just replace what? Head with titanium metal. Now, I practiced for 12 years before I migrated here in 2002. Based on my experience, most of my patients, they prefer the total hip. Why? Because this is metal, and that is what? Normal bone or ship. Very painful. Did I say ship? Stool, okay? And we do physical rehab, and gait training. So they would rather have what? The hip replacement, okay? More money for the doctor. I'm sorry. Better for the patient. Did I say more money for the doctors or surgeons? Did they get any money from the manufacturers of this prosthetic device?
No, I don't think so.
You don't think so?
I know the reps do. The reps
I'm just joking. These doctors are not supposed to be businessmen, but they are. I remember, I don't have to comment on those orthopedic surgeon friends of mine, you know. I don't know, because here if you work with Kaiser, then Kaiser controls the, you know. So if you work with a private hospital or private practice, sky's the limit. Okay. On how to become rich, okay. Now, in other words, that's a hip replacement. Now, So in other words, what we said just said is that it's important to know this. Now let's go back to the bones in terms of, we said there's a spongy bone and a compact bone. What are the bone membranes here, class? Outside would be what? Periosteum, and inside, where you have the medullary cavity, endosteum. Now where are the blood vessels attached to? In the periosteum. That's why whenever we have broken bones, we must make sure that at least the periosteum is intact, because please look at your diagram, the blood vessels are attached into the periosteum, right? Now, in terms of a long bone like this, like femur, tibia, fibula, what do you call the ends of the bones? Proximal epiphysis, distal epiphysis. Proximal epiphysis, distal. What do you call the shaft? The diaphysis. What do you call the area between the diaphysis and the epiphysis? Metaphysis. Okay? So this is diaphysis, the shaft, epiphysis, metaphysis, metaphysis, epiphysis. What is proximal? What is distal? The same thing here. Proximal epiphysis, distal epiphysis, diaphysis or shaft, metaphysis, metaphysis between the diaphysis and then what? The epiphysis. It's called metaphysis, right? Okay. Now, in terms of the division of the skeletal system, it could either be eggshell or what? Okay. When say eggshell, we're referring to what? The skull. What else? The three bones in the ear called the auditory ossicles, 3 on each bone, right middle ear, left middle ear. The spinal column, like this one here, right? Does that include the hyoid bone here? You see the hyoid bone here, the small bone in front? Now, it's not supposed to be attached to the bone here, but it's supposed to be attached to muscles. So the hyoid, the vertebral column, what about the rib cage? Is that eggshell skeleton? Which includes your what? Your sternum, right? Okay. So let's deal with the eggshell skeleton first. Eggshell means axis. Skull, hyoid, spinal column, rib cage, sternum, and the rib cage. With regards to the bone here, what do you call the bone in front? I'm still okay? Good. What do you call the bone at the back? Is it backbone or front? Okay. Yes? Okay. What about the bone on top? What about on the side here? Okay. What is the suture between the frontal bone and the parietal bone? What? What? Coronal suture. What about the suture between the left and the right parietal bone? What about the suture between the occipital bone and the parietal bones? What about the suture between the parietal and the temporal bone? Ramus suture. Very good. Now there is a bone inside which I cannot anymore open up, like a butterfly or a bat. It's what? The sphenoid bone. Now there is a structure in the sphenoid bone called the cilia turcica. What is found in the cilia turcica of a sphenoid bone? What gland? Oh my God, you're so smart. What's the name of the gland? And where is that found? Where? Cilia turcica of what bone? Sphenoid bone. What part of the cilia turcica? It's called the hypophyseal fossa. A fossa is a space. Hypophysis is another word for what? Pituitary gland. What's another word for pituitary gland? Hypophysis. So what is the name of that fossa in this cilia turcica of the sphenoid bone? Hypophyseal fossa. You understand. Okay? And why is the pituitary gland important, class? It is the master gland, which basically produces a lot of hormones. But it's controlled by the hypothalamus, which is the master of the master gland. Hypothalamus controls the pituitary gland. Pituitary gland more or less controls other glands of the body, other endocrine glands. That's why it's called the master gland. Okay? So that is where it is, right? In the sphenoid bones, hypophyseal fossa. Okay, now, so this is, the sphenoid bone is actually what we call the keystone bone. What do you mean by keystone bone of the skull? It's the bone that is what? In the middle. Now our skull has two parts. Cranium, and what about this one? What do you call the bones of the face? Facial bone. Don't you love anatomy? What do you call this bone here? How many mandibles do we have? What do you call the bone at the base of the nasal septum? Huh? What? The what? The bone at the base of the nasal septum. Vomer. How could it be? Maxilla is here. The vomer is there. Vomer. At the base of the nasal septum is the vomer. How many vomers do we have? What about maxilla? How many maxillas do we have? One on the left, one on the right. What do you call the cheekbone? Zygomatic bone. What do you call the cheekbone? Zygomatic bone, right? Okay, now, what is attached to the upper teeth would be the maxilla. The lower teeth is attached to the mandible, right? So when you do dental implants, are we going to drill a hole there to be able to insert that dental implant? It's more dangerous to do it here than here. Why? Because it's really near the brain, right? And the sinus is there, so they have to do a CT scan. They're planning to do it on me, but I'm scared. If I go to my brain, and I won't be able to be here next week, so. How many of you have done an dental implant? No one yet? Okay. You're all young, so I still have an intact set of teeth. Me, I miss my teeth. See? I'm just putting what do you call the thing? I don't know what it is. Huh? Dentures with this thing. It's so crazy. Every time I eat in the restaurant, I have to remove it. Everybody looks at me and I don't know yet. I don't know. It's expensive to have a dental implant, but let's see. Now, anyway, so in the skull, you have what we call bony air spaces. And yes, my dear, what's a bony air space? The Garcia sisters, right? Who is Sandy? Who's Kimberly? What is inside a bony air space or sinus? Shh. My good, are you Kimberly? The last time I heard you were Guyani. It's what's inside the bony air space. What is inside a bony air space? Huh? Are you sure? Okay, I hope you don't mind my name. I've been teaching for a long time. You say air? Air? Is that different when you say air? 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 Your sister's laughing. You spark her for me. Spark! Don't you laugh at your sister? Who's older? See? Oh my God, you're younger and you're smiling, laughing at your older sister. Just relax, chill. I'm not here to humiliate you, but you have to be more confident. You say, air! That's what it's called, air space. I actually gave you the answer. Just relax, chill. I saw her face, it's just turning pale already. I don't even have the question. When you become a nurse and a patient asks you, what's inside the bony air space? Remember, these patients will ask nurses. So you have to be confident, even though you know the answer. I look it up, sir. Okay, air. Okay, because you have helped your sister. Why is there a need for the air in that bony air space, your sinus? You still see me? Yes. What is the need for air in the air space? Yes, I see a hand.
It helps with your voice. I forget what they call it.
It's called resonance.
Resonance, and also to lighten your skull.
I can tell this guy is studying his notes. And where did you get that information?
In the book.
Where?
In the book.
Where?
In the book.
Yeah, in the book. Two things. The air in the air spaces lightens the skull because which is heavier? Air or skull or bone? Lighter. So it makes us, if I were to lift my head and skull, lighter. And of course resonance. In the air spaces called sinuses, there's air. A sinus is air space. It contains air to lighten the skull, and I'll tell why resonance. What is found in the wall of these sinuses? Yes, you. What's your name? Jeffrey. Are you in my lab, Jeffrey? It's okay. What did I say in the lab? What does the air space line with? Okay, your neighbor to your right. What is her name?
Elizabeth.
Do you know her name?
Yes.
You know her phone number?
No.
Why not? You're supposed to be friends, right? Okay, Elizabeth. What is lining the wall of a sinus?
Mucus?
Mucus or mucous membrane?
Mucous membrane.
And what does a mucous membrane secrete, Elizabeth?
Mucus.
Oh my God, don't you love anatomy?
Love it.
So we have sinuses, frontal sinus, ethmoid sinus, sphenoid sinus at the back, and the biggest would be what? What's the biggest sinus? Maxillary sinus. So the mucous membranes in the wall of the sinuses will produce mucus, and where will all this mucus go? Into the nose. That's why it's called, they're called paranasal sinuses. And why is there a need for those mucus to go to your nose, Mayday? What's your name? Huh?
Amy?
Yes, Amy. Just relax, Amy. Don't turn red. If you don't know the answer, you can call a friend. Why is there a need for the mucus to go to your nose? From the frontal sinus, sphenoid, they're called paranasal because they go to the nose. Yes, Amy?
Well, there's no
Huh? What? Okay, I see a hand.
To make it moist and humidify it?
Why is it? Okay, the answer is correct. The presence of mucus, which is partially what? Water, helps humidify the air, moisten the air, liquefy the air. How many words did I use? 3. That's how you become smart. I'm not saying I'm smart, but I'm saying humidify, moist, liquefy. Have you ever been to a hospital? You see those oxygen sources on the wall. There is air with what? Water bubbles. Oxygen source. So we got that idea from our own human body. The water there will what? Moisten the air. We don't want dry air to enter the lungs because the lung is moist. So it will humidify. Have you heard of the word humidifier? Water, nebulization, humidification. You understand? What else? What else? Yes, Mr. What's your name?
Paulo.
Morato?
Yes.
Paulo Morato.
To excrete bacteria, I think, right?
To excrete or trap the...
Oh, trap it first.
Trap the dust and bacteria. Trap, why? Because it's moist. It gets trapped there so that it will not enter the lung. And what happens if this dust particle or foreign body gets trapped by the mucus, and when the mucus dries, you form your what?
boogers.
Booger. And what exactly is boogerectomy? Well, I shared this in my lab class. According to Dr. I've written a book, joke only. This book is called The Medical Dictionary for Crazy People. Page 545, verbatim, and I will quote my own self. Boogerectomy is the surgical removal of the booger with the use of a natural scalpel called the finger. Inserted in an upward rotatory motion into what we call the nostril. And then, so in other words, after I come from Anaheim, I travel from Anaheim, I came here, I do what? Multitasking. So I'm driving on the freeway. One hand is on the steering wheel, one hand is here. So don't you ever shake my hand unless you want to feel my boogers. I'm just joking. In the presence of a pretty woman on another car, I will just say, abort, abort, abort. If it's another guy, I don't care. I'm just joking again, okay? So you are right, it will trap the dust or particle, it will humidify the air. Now what happens when you have sinusitis? It's inflamed. What is inflamed? The sinuses. The membranes are inflamed. Will they overly produce mucus? Yes. If there's a lot of mucus, too much mucus will cause sinus congestion. What is congestion? Congestion means increase in the accumulation of what? Mucus. And that is also water. Will that increase the pressure inside the sinuses? Will that lead to the development of what we call a sinus headache?
Yes.
Sinus headache due to sinus congestion, due to sinusitis. And what do you think Dr. Gamo will prescribe this patient? Congestion. I give what? A nasal what? A what? A what? A what? A what? Don't you love medicine? Pharmacology? 18% of the questions in the nursing board exam has to do with what? Pharmacology. And it's so amazing, simple. I give a nasal decongestant because the problem is congestion. And why is there congestion? Because there is overproduction of what? By the mucous membrane where? In the wall of the sinuses, called mucous membranes. Because it's inflamed. And what will these decongestants do? It's like a faucet. Just turn off, close the faucet, it completely stops. One of the best I have tried so far is pseudoephedrine. Have you tried pseudoephedrine? Sudafed. Have you heard of Sudafed? Yes. Okay. Is this effective? Yes. Very effective. Pseudoephedrine is very effective. Take it, stops the runny nose. The runny nose becomes walking nose. And the walking... Have you not heard of the word walking nose? Is this the first time you heard of the word walking nose? Oh, you're so millennials. No, I'm just kidding. There's no such thing, but I like to come up with crazy ideas. From running to walking nose and stop nose. Now, what is good about pseudoephedrine? Very effective. Now, what is bad about pseudoephedrine? It's bad. Why? You can convert that into what? What? Who said meth? Oh, I can see the expert here. Look at his eyes. Red. It's called what? Methamphetamine. Okay. So it's a drug that causes you to become addicted. I think they told me it was shown on Breaking Bad, the movie. It was a chemistry professor who did this. I've night shift from being a professor in chemistry and become a businessman. And you'll be all my experiments, which one is good or not. So that's why when I remember when I first came here in 2002, I could easily get this Sudafed over the counter. 2 or 3 years later, I need a prescription. And he is right. They convert that into from this to this, more money for them, which is bad. Decide to make you for nasal decongestants. Okay? Now, regards to the exoskeleton, therefore, let's move on to the spinal column. There are 7 cervical vertebrae, 12 thoracic, 5 lumbar, sacral. They became fused into one, right? Called the sacrum. Okay? The cervical vertebrae, of course, you have the body here, the intervertebral disc, which acts as like a shock absorber. It contains 2 things. What are the 2 things inside this IV disc? Nucleus pulposus, and what's the other one? Nucleus pulposus, which is made of your mucopolysaccharide, and what's the other one? What surrounds the nucleus pulposus? Yeah, the disc is made of 2 parts. Nucleus pulposus in the middle, yes. And what is the one that surrounds the nucleus pulposus? Anybody remembers? I want you to research on that, okay? Now, observe that you have the spinous process, the transverse process, and then in the neck or cervical spine, what do you have? The curve. In the cervical lordosis, what's a lordosis? Like this, right? Letter C, lordosis. Then you have a lumbar lordosis. And then here you have the thoracic what? Kyphosis. Very good, okay? So we have what they call primary or natural spinal curves. Number 1 will be what? Thoracic what? Kyphosis, like a hunchback. And the other one is what? Sacral what? Kyphosis. Why? What is primary? You develop this where you will stay inside the mother's womb. When you were, how many of you remember the time you were inside there for 9 months? Am I the only one? Okay, including him, the 2 of us. Okay, I remember. It's very vivid. I was doing this. That's a kyphosis, like a hunchback, you know. Okay? Like this. Then what happened? I developed later on what? Secondary what? Curves, spinal curves. One would be cervical what? Lordosis, like Lord of the Rings. Cervical lordosis is that letter C, like this, C. When do you develop this lordosis? Yes.
When you lift your head up, or when
Very
you can
good. Are you in my lab?
No.
Oh, very good. Where did you learn that?
In the book.
Oh my God! Again, it's the book. It's the culprit, really. So when you were a baby, what's your name?
Brianna.
Brianna. You were lying down like this, right? In the bed. And then you rolled over like this. And what did you do? What did you do? You lift your what? You lift your what? Why? Because you're looking for mama. Mama? Mama, I need your left breast. Mama? Mama, I'm hungry. I need milk. So every time you lift the head, will that strengthen the muscles at the back of here called the paraspinal muscles?
Yes.
Did you develop your lordosis by doing so? Now what about lumbar lordosis? So what's the key word here? Lifting of the head. Lifting head. What about the lumbar? Lumbar lordosis. Yes? Very good. Stand. Stand. Like this one. A baby is crawling in the crib. And then what? Look, Ma, I'm standing. I have developed my lumbar lordosis. It's an acquired curve. Why acquired, Mom? Because I developed it after I was born. When I started to what, Ma? Stand. What about cervical? Lift head. 2 words. Lift head. Stand. Stand. Lift head. You understand? Yeah. Okay? Now the rib cage, the sternum. What do you call the upper part of the sternum? Manubrium. The middle part? The lowest part? Okay. What about you, my dear? When you're doing chest compression, where do you put the heel of one hand? On the manubrium, the body, or the xiphoid process? Why?
So that the balance is in between, and because if you put it on one end, then it might break.
What?
It might break.
Okay. I'll ask you a question. Where do you find the heart?
In the
Underneath the manubrium, body, or xiphoid process?
body.
And that's the reason why you answer that way. You don't say because it will not break or it will break, you know. All you need to say is this. I'm trying you to come up with an answer that is direct to the point. It's like the nail head hit it on the head. So you say, what is your answer?
The body.
Why?
Because the heart is beneath it.
That's what you answer. How you answer, you know? That is what I expect you to be able to answer me, which is logical thinking. The reason why when we do chest compression, we do it here, right? The body, why? It's where the heart is. When do you do chest compression? When the patient goes into cardiac arrest. What is cardiac arrest? The heart stops pumping blood because it went into arrest. There's no activity, no longer pumps. So you have to pump for the patient. When you pump, you want the blood to go to the brain. And Rishi is right. If you do it in the xiphoid process, it could break. You have a fracture there. It could puncture your liver and your spleen and your lungs. It could actually cause the death. You understand? Manubrium is stupid because there is no heart there. I'm sorry, I'd like to take back my word. Incompetent. Now, how deep should the chest compression be? Anybody? Okay. 2 inches is better. Done after 2 inches, depending on the size of the patient. What happens if it's only 1 inch? Useless. Because you're not compressing the heart. You're killing the patient softly. Killing me softly with his song. I'm not kidding. There are people who are lazy. I've seen these people doing CPR then. And you can see from their faces they're tired and they're, you know, just want just to do the act of doing it. Just to put compressed, dog. Just want to bring the blood to the brain. If you're just gonna do that, you're just going to tickle the body. Tickle, tickle, tickle. You're not doing anything. So make sure, 1.5 to 2 inches compression, important. 2 inches, very important, okay? So, now, let's go to the rib cage. The upper limb is attached via the pectoral girdle or shoulder girdle made up of the clavicle, and then what? Scapula, right? The scapula is also known as the shoulder blade bone, and of course, the clavicle is known as the collarbone. Collarbone, right? You have 2 clavicles, you have 2 scapula. What do you call this part of the scapula? You call the spine. What do you call the space above? Supraspinous fossa. What do you call the space below? Infra means below. Spinous fossa. Here, subscapular fossa for the subscapularis muscle. Okay? Now, in the spinal column, you have this intervertebral foramina. What comes out there? Spinal nerves. The yellow nerves here. Now, what happens if you have a slip disc? Can that compress the spinal nerve?
Yes.
So it's called slip disc with compression of the nerve roots. Can that cause a lot of severe pain?
Yes.
The form of a sciatica. Okay? Very, very painful. Understand? Okay? Now the disc is there for the purpose of shock absorption. Right? You understand? Weight bearing, shock absorption. Okay? Now in the upper limbs, what do you have here? This is part of now of what we call appendicular skeleton. Shoulder girdle with the upper limbs, pelvic girdle with the lower limbs. Appendicular from the word appendages. How do you spell appendages? A-P-P-E-N-D-A-G-E-S. Appendages. What is the bone here in the arm? Upper arm. Humerus. How do you spell humerus? H-U-M-E-R-U-S. What are the 2 bones in the forearm? Radius and the ulna. Which one has the olecranon process? When I used to play basketball, this is what I used to hit my opponent. Go for the rebound. What do I hit them with? Olecranon process of what bone? I'm just joking, I'm a nice guy. I was the one who gets hit. Now what is the one with the radial head? Radius. So when you go like this, the thumb is in the area of the radius. Thumb, radius. That's why what do you call the pulse here? Oh my God, don't you love anatomy or rather? Radial pulse. Ulna, radius, radial pulse. How many carpal bones do we have? We have 8. Which one is the largest of them all? Capitate. Which one is easily broken because it's near the radius? Scaphoid. Easily broken or fractured or displaced. Okay? And then of course, the one with the hook. Hamate. H for hamate, H for hook, right? You have 5 metacarpal bones. 1, 2, 3, 4, 5. You always count with the thumb. 1, 2, 3, 4, 5. How many phalanges do we have? 14. Why? 1, 2, 3, 1, 2, 3. Proximal, middle, distal phalanges. Proximal, middle, distal phalanges. In the case of the thumb, you only have what? 2. Proximal and what? Do you know why? I don't know why. If you know why, tell me. Teach me. Tell me why. Okay? Okay. In the lower limb, you have what? The femur. Where's my femur? Okay. And what about the bones in the leg? Tibia and fibula. Which one is the weight-bearing bone? The tibia, the bigger bone. Weight-bearing. Smaller bone, fibula. Okay? And then what's the bone above, below the tibia? Talus. Then the one here, heel bone? Calcaneus. Talus, calcaneus. What is the bone in front of the talus? Navicular. What's the bone in front of the navicular? The 3 cuneiforms. Medial, intermediate, lateral. What do you call the bone in front of the calcaneus? Cuboid. C for calcaneus, C for cuboid. Right? How many metatarsal bones do we have? First, second, third, fourth, fifth, metatarsal. In the hand, it's called metacarpal. Here, it's called metatarsal. And how many phalanges do we have? Just like the hand, fingers? How many? 14. 1, 2, 3, 4 times 3, 12 plus 2, 14. Okay? Is that clear, class? Okay? So these bones are important, and as we said, you have to know all these bones. I know some of you are doing AR. How many of you are doing AR? I think that's the, is that the section 2-4 and 2-. All of you are doing AR now, right? Oh my God, oh my God. So, you like AR? It's like playing video games? How many of you develop vertigo and dizzy?
The first time, yeah.
First time around, okay. Are you still dizzy on the second time around?
Yeah.
Still dizzy? Okay. Me, I like it.
Not for business.
I can go inside the bone. Okay. So the bottom line, therefore, is that are these bones important? Yes. Now the joints. In general, most of these joints are easy. What kind of joint? So if there's no more time, what kind of joint do you find in the elbow? It's called hinge. Why hinge? Because like a door, you open it and close it, right? A hinge joint is your elbow joint, just like your what? Your knee. So look at this. Look, everybody look. Flex, extend. Just like the door. When you open the door, what do the doors have? Hinges. A hinge joint is a joint that can allow flexion and extension. That's opening and closing the door. Now the knee is unique because it's a modified what? Hinge. It can also fold like this, like flex, extend. Flex, extend, but there's some degree of rotation. Rotation of the knee. Okay? Now what about, of course I already mentioned about what? The shoulder and the hip, it's what? Ball and socket joint. What is an arthrogel joint? Sliding or gliding. Arthrogel, gliding or sliding. Now, in other words, these joints, most of them have what they call capsules. Synovial joints have synovial membranes. And what do the synovial membranes secrete? Synovial fluid. What is the purpose of the fluid? Lubrication. It's like your natural KY. Right? What is the purpose of KY? Reduce friction. So that every time I move my knee, there is no pain. I move my elbow, there is no pain. When a knee is swollen, what happens to the amount of fluid there? It could be more. It's called joint effusion. Have you heard of that word? Joint what? Okay, what is joint effusion? Excessive secretion of what? Synovial fluid by the synovial membrane. Good or bad? Bad. Because that will limit what? Movement of the joint. So what will Dr. Gamo do with the fluid there? Remove or drain? Drain, right? It's called arthrocentesis. What exactly is that? The doctor needs, you have to provide me with a sterile needle syringe that I will drain the excess fluid. What do I do with the fluid? Drink it or send it to the lab? Send it to the lab. You want to find out, is this because of an infection? You do a culture testing for cultured bacterial growth? Or is this because of malignancy or just plain simple arthritis? Sometimes you might be able to see uric acid crystals. Have you heard of gout? Yes. Have you heard of gout? Yes. And gouty arthritis? It usually affects the big toe joint, big toe. How many of you are suffering from gout? Okay. Now gout used to be a disease of rich kings and queens. You know why? Are you a king?
No.
You're not, okay? Yes, why? Okay, when you are rich and you get all the wine and women, wine and, just laughing. Wine and all the food containing uric acid. Gluttony. So these kings keep on drinking wine, and then they wake up the following day with a swollen big toe. And that is called what? Gout. The problem with gout is that there is the deposition of what? Uric acid crystals in the joint. Is that going to be painful? Yes. Imagine to have what? A broken glass. Break the glass and put that inside your joint. That's how painful it could be. Very, very painful. Swollen. The only problem there too is that these uric acid stone crystals will deposit in your kidney and you can develop kidney failure. Is your gout controlled?
Yeah, I had it one time and I didn't.
Did you have your uric acid serum blood levels monitored regularly?
After that they did for a while, but I mean this was like.
Do you still drink a lot of? Well, drinking.
Not as much red meat.
Okay, drinking is bad if it's too much. In moderation, it's fine.
I mean, it was definitely. I never drink anymore.
And then what about? Did they give you a colchicine? Have you heard of colchicine?
They gave me some sort of steroid for it.
No.
And it helped right away. But
steroid is anti-inflammatory drugs. Same thing with colchicine, it helps, right? but you don't want to have gout. It's very, very painful. I have never experienced it, but I hope I will not. It's very, very, I know it's very, one time I had this lawyer, patient of mine, he was supposed to have a court hearing and he couldn't, he was placed in a stretcher, he couldn't move his knee, he couldn't stand, he couldn't walk. He went to my clinic, I had to inject him with steroids at the same time with anesthetic, lidocaine. Oh my God, amazing. He paid me more than because he was happy. Okay, cut. Okay, anyway, I'll give you a 10-minute break. You can come back, we'll have the quiz, okay? I'll see you in 10 minutes, break.